Hi there. My name's John. I've been a patient with type 1 diabetes for the past 45 years. I'm also an ER physician in New Hampshire, and I spent about 15 years of my life working with type 1 and type 2 diabetes patients in a diabetes center in northern New York. So, about 8 weeks ago, I started this video series to have open discussions, review topics, ideas, hints, share stories, entertain, maybe educate, and have fun with diabetes. I'm a big believer that diabetes is a lifestyle, not a disease. I also state, that I'm driving the car. Diabetes is in the back seat. I need to respect it and listen to it, but I will not let it run my life. So in the past, I've encouraged all of my patients to do the same, and I certainly encourage all of you to think about that. As we progress through these series, we've done a lot about diabetes camps, diabetes in school and college, even had my mom on for an interview. I want to make sure that people don't take this as medical advice. If you hear an idea or a thought here that you might like to incorporate into your care plan, please talk to your provider. So, we covered a lot of type 1 over the last few weeks. Obviously, I live with type 1 and have a very strong personal connection, but there's a much bigger problem on the horizon. Today, we're going to break down type 2 diabetes. We're going to look at the essentials of this silent epidemic that is hitting this world. Currently, diabetes is the number one growing issue worldwide. So I remember growing up, type 2 was always older folks. You know, maybe you'd see a college kid, pretty rare though. Nowadays, we're seeing it at 14, 15 years old, see it in high school, even some elementary schools. So to me, that's very scary. And I think it's important that we all have some grasp of what's going on with this disease. So let's take a look at the two. Personally, I think type 2 diabetes is a misnomer. I believe in my disease, sorry, my type 1 diabetes, where I don't have the ability to make insulin secondary to an immune response from my body. In other words, my own body wiped out my ability. It's very black and white, it's very simple. The treatment is replacement of insulin. Type 2 is much more complicated. It involves a lot more systems, and more than just genetics, it involves lifestyle. So on that ground, I don't really like using the term diabetes, but it is what it is, and I'll deal with it. So with type 2 diabetes, we come to a major issue of insulin resistance. So what does that mean? We've talked about insulin before being the key that unlocks the door to let the glucose into the cells from the blood. In other words, lower and maintain blood sugar. Insulin does a lot more than that. It's involved in inflammation, it's involved in cardiac health, it's involved in stroke prevention, depression, hunger management, fat development, fat storage, cholesterol levels. I think we're on the edge of discovering everything that insulin does, but we're still not quite there yet. So this is a hormone produced by the beta cells of the pancreas that is incredibly active and involved in a lot of processes in the body. So one of these that we've talked about most commonly is maintaining blood glucose balance, letting that sugar get into the cell so the cell can use it for energy. So we understand that there is a level of insulin resistance with type 2 diabetes. Sometimes there's a genetic factor to this. All times there's a lifestyle factor to it. So if their genetics are there and you're bound to determine that you're going to be insulin resistant at some level in your life, okay. But there's also the lifestyle part of it you can control. So we see insulin resistance go up significantly with weight. We also see it go up significantly without exercise. So we tend to think of those two things always connected, but in this case, they're very separate. If you think of the post office, small village, get their mail by 11 a.m. every day, right? There's 50 houses. The mail folks have no problems delivering it. Really easy. But then that person gains weight and the ability to deliver mail is hampered. And now they're getting their mail by 3 p.m., maybe 4 p.m. And as they continue to add more homes or gain more weight, their ability to deliver the mail is hampered and resisted more. So as a person gains weight, because of the amount of fat cells, it becomes more and more difficult for insulin to do its job. Now, we talked about with type 1 diabetes where exercise loosens that door a little bit, makes it easier for the insulin to work, makes it work better. Some muscles will even take up take up glucose without insulin. So, lack of exercise compounded by additional weight increases your insulin resistance to a dramatic factor. Other things that impact this is quality of sleep, stress, dietary choices, types of foods that we eat. High carbohydrate foods equal a high burden for the pancreas to handle. In other words, a lot of work for that insulin to do. So I used to use the analogy with my patients. I give you a pair of shoes and I have you, walk a mile a day. No big deal. Your shoes will do pretty well. And now I'm going to have you walk 10 miles a day because you've gained weight and you've got more cells to deliver insulin to. And your shoes don't work as well. And your quality of your shoe isn't as good because your activity levels are going down and your stress is high, you're not sleeping well, and you're eating poorly. Your glucose in your food is going through the roof. You're eating carbohydrates like crazy because you eat that carbohydrate, you feel energized, and then within a couple of hours you're wasted again because it's a poor choice of food. So now your shoes are falling apart and you can't walk nearly as well. And this is how your insulin resistance builds to a level where your pancreas has to work so hard to keep up with it that it starts to fail. So the insulin resistance graph starts rising. Okay, I'll use this for my insulin resistance. It's on the way up. My ability to produce insulin, I've been producing a lot more because of the demand and the fact that it doesn't work as well. Then my ability drips and we intersect. And now what I have is elevated glucose levels. Now I have someone putting a stamp on it saying, oh, you have type 2 diabetes. Welcome. This is happening, this intersection is happening earlier and earlier and earlier in life because we, especially in America, are leading a much more sedentary lifestyle. In other words, we don't get off our duffs and away from the magical screens. Everything's on a screen, whether it's on our phones, on our computers, our iPads, our PlayStations, our Xboxes. We're glued to the screen. We're not active. That has a huge impact on muscle uptake of glucose and insulin resistance. Our quality of food has an extremely high glycemic index, a tremendous amount of seed oils, very high protein. I'm sorry, scratch that. Very high carbohydrate and low protein. As a result, the burden on the pancreas to make a lot of insulin is there. And that ability dissipates over time, especially when I'm telling that pancreas, hey, before I needed 1 gram of insulin for 1 gram of carbohydrates. Now I need 3. But I'm also eating more carbohydrates. So that pancreas is trying and trying and trying, just can't do it. Add to that stress, inflammatory markers, seed oils, oxidative stress, all of these things going on inside the body because of what we're putting in. Hurts the heart, hurts the ability to produce insulin, hurts the effectiveness of the insulin, leads to diabetes, leads to weight gain. Add to that the inactivity we just talked about, the screen addiction. We get more weight gain, which also adds to insulin resistance. And you can see how we're in a vicious cycle of one result of feeding the problem and the problem feeding the result. And hyperglycemia or high glucose levels are guaranteed result. And once you meet that laboratory criteria, we say, welcome to the world of type 2 diabetes. The unfortunate thing that I don't think our greater society has figured out completely yet, and there are some great folks that talk about this. I've talked about a couple of different lectures I've been to focusing specifically on insulin resistance, in fact, the University of Utah does a lot of work with it, we can identify insulin resistance much earlier. There's various calculations that can be done based on laboratory work. There's even a waist measurement versus height calculation you can do at home. So there's ways to see, am I insulin resistant? And address that before your ability to produce insulin goes away and you get welcome to the world of diabetes. So my takeaway points are, you don't need to measure, you don't need to figure it out. If you feel like you might be overweight, there's a good chance you're likely insulin resistant. If you feel like, geez, I shouldn't have binge watched Game of Thrones last month for 17 hours or however long it took, there's probably a good chance you have some level of insulin resistance. So we need that activity. We need to make sure that our weight is controlled, and we need to watch the quality of food as well as the stress in life. Now, granted, the stress in life is tough to manage, but make sure you're getting good sleep. Make sure you're eating correctly. And I'm not saying you need to go spend $1 million at the organic food store, but if you look at your basic grocery store, your outside edges tend to be more natural. The further into the center you go, the more processed they are, the more seed oils, the more changes have been made to that food that could potentially have a huge negative impact on you. And I've said this before, and I'll say it again, watch the carbohydrate load. I've been eating a predominantly very low carb, high protein diet for almost a year now, and I will be doing a video about that. And it has had a phenomenal effect on my insulin. My insulin use has gone way down. Keep in mind, I'm injecting it or through the pump. So imagine what it does to someone who has to produce their own. My weight went down, my energy levels went through the roof, my quality of sleep improved, everything about my life improved. I have to be completely honest. The only thing that's difficult is if we go out for dinner. So more difficult to figure out what to eat on the menu, but that's a minor issue. So insulin resistance, deterioration of insulin production, blessed with type 2 diabetes. What are some of the symptoms you might experience? So if we look purely at insulin resistance, you're going to see symptoms like weight gain, fatigue, poor quality of sleep. As we move towards the diabetes stamp, you're going to see slow healing. You know, that scratch you got in the arm the other day that used to be gone in a day or two is now a week or two. You're going to see increased thirst. You're going to see more frequent urination. And this is another little cycle we get into. Look at your night times. How are you sleeping? Well, yeah, I sleep great, except I was up 4 times last night to pee because my sugar was a little bit higher. Remember, we've talked about this, how when the sugar creeps up, water is used to flush that glucose out. So you're peeing more, which is interrupting your sleep, disturbing your sleep cycle, giving you a poorer quality of sleep, increasing the stress in the body, adding to the insulin resistance. So important that you watch for these symptoms, and the earlier you can catch them and address them, the better off you'll be. So those are some of the key symptoms where you need to say to your doc, hey, you know what, I'm a little concerned. I'm concerned about my insulin resistance. Can we check that? And can we get a blood sugar, hemoglobin A1C, put a CGMS, a continuous glucose monitoring system on me, an oral glucose tolerance test, which is the gold standard. You know, can we do something like that to see what's going on? More than likely, you're correct. And you may very well be blessed with type 2 diabetes. There's a lot of risk factors for this. Obviously, you know, obesity and inactivity are certainly risk factors that we talked about. There's also ethnicity, there's genetic risk factor, there's a long family history of it. I recommend as a young person, you look at that family history and say, what can I do to improve my quality of life and avoid that or reduce my risk? But taking all those things into account, you're going to the doc with increased thirst and urination, maybe some slow healing, poor sleep, increased fatigue. The likelihood of getting stamped with a type 2 diabetes diagnosis is very high. So what do we do about that? Well, the first thing is monitor, and I've talked about this before. We're in a blessed time right now because we have the ability to monitor our glucose levels very simply with a blood test. We also have the continuous glucose monitoring systems, which are wonderful. I would recommend every person get put on them. Some of you in school, in high school, maybe had to take care of a baby. I know a lot of public schools pay for this high quality thing that is battery powered and will cry and wet a diaper and all this craziness, trying to teach responsibility, trying to teach kids to be smart before they end up in trouble. I would recommend, along with that health class, we put a sensor on you for a week. Let you see what a pizza does to you. Let you see what that bowl of cereal does to you in the morning. Or, my own kids have done this. I'll have a bowl of cereal and then I'll have a bagel. Look at the carbohydrate load. That's more carbs than I eat in a week. But with the glucose monitoring, you can actually see how that impacts your blood sugar and the work that your own pancreas has to do to catch up with it. We've used it in my weight clinic in the past as education. See how these things impact your blood sugar, see how hard you have to work to fix it. And it's real good at opening the eyes of folks and giving them some level of education. So the first part of handling our diabetes is monitoring it and getting an idea of where we are. I've talked about the hemoglobin A1C before. Just a quick review. This is a 3-month average blood glucose level. The reason it's 3 months is we're counting particles of glucose on a red blood cell. They tend to live for about 3 months. So it gives an idea of where your blood sugars have been. Personally, I find the continuous glucose monitoring systems much better because I can give you a good A1C with a lot of highs and a lot of low sugars. It's an average. Whereas with the CGMS, you can see the flow of the graph and see how well you're doing. But again, these are all excellent opportunities. Important that we monitor what's going on with our life. I talked about it earlier. Lifestyle is a big thing here. Watch that weight, increase that exercise. And I know this is everyone, we hear this all the time, exercise more, exercise, exercise. We never do it. So simple things, real simple things, guys. Park your car a little further away from whatever your store you're going into. That 5-minute walk will not kill you. Every little bit of exercise counts. You're going to the grocery store, you just need to get one thing, but you're not in a rush. Walk around, push the cart, go through all the aisles. You might find that you needed laundry soap. Just get yourself moving. Take some time in the evening, go for a walk with your significant other. Walk your dog. Elliot Joslin, whom you know is a huge hero of mine, used to prescribe puppies to folks with diabetes to get them out walking. Because they knew even back then, before the discovery of insulin, that exercise reduced glucose levels. Exercise allows the muscle cells to use that glucose. So exercise improves how your insulin functions. That's the flip side of that coin. So it helps you use glucose better. It makes it easier on the pancreas and easier on the insulin. It reduces your resistance to insulin. Lifestyle changes like that can have a huge impact for folks. I highly encourage everybody, regardless of where you think you stand on this spectrum, to institute these changes. Get out, get some activity, reduce your screen time. Parents, watch your kids on the screen, get them moving, get them active, buy a bike, buy an e-bike with the pedal assist, so at least you're doing something. The more you can get in, the better you will feel. The quality of life will improve, your quality of sleep will improve, your insulin resistance, if present, will go down. If not present, you're going to delay it or stop it. So it will never be present. So those are the big ones. Watching weight, quality of food is a huge one. Try to reduce your carbohydrate intake. And for those of you that already have diabetes, be it type 1 or type 2, try it. Just for fun. See where your sugars go when you skip carbs for a whole day. It's pretty interesting. Now, if you're on a fixed amount of insulin, you may need to treat with some carbs, and that's fine. But focus on simple carbohydrates. I've mentioned it before, maple syrup, honey, real simple, real easy. Get out of the concept of sugar is bad for me, because sugar, C6H12O6, glucose, is what every single carbohydrate we eat becomes. An apple, a banana, a slice of bread, pancakes, cereal, candy bars, all become glucose. So it's better for you when you need some carbs to go simple, like your fruits, your maple syrups, your honey. But it's even better for you as much as possible to reduce that carbohydrate intake, give your pancreas a break. See, for those of you with diabetes, just see how your blood sugars do. If you're wearing a sensor, it's even better. You'll see some amazing numbers and amazing stability. If you're on a pump, monitor those numbers, but also look at the amount of insulin you're using. You'll see that it goes way down. And it's very, very impressive. And I laugh because We talk about in nutrition classes where you have the essential amino acids that we have to have because they're building blocks for the body. These are proteins. We have essential fatty acids. You have to have them. They're the building blocks of the body. These are fats. There are no essential carbohydrates. They don't exist. So it's pretty impressive. Protein will have a little bit of impact on your sugar levels. Fat will have an impact on your sugar levels. Nothing like glucose, especially the ultra processed, high fructose corn syrup type things. Again, I'm going to have another video about diet, but just to touch bases on that with lifestyle changes, diet is a huge part of it, both for type 1 and type 2, especially for type 2, if you're trying to prevent that insulin resistance to getting so bad that you catch the label of type 2 diabetes. Medications, there's a whole nother video series on medications. The good news is now the FDA's aim for medications for type 2 diabetes is cardiovascular safety. So we want to make sure it's safe for the heart. There was a big issue years ago about pioglitazone causing cardiac issues, and Avandia was another one of those causing cardiac issues. So the FDA wants to make sure the heart is protected, preferably benefit, which certainly is a selling point for the pharmaceutical companies. No weight gain. We see weight gain with your sulfonylurea medications, your glyburide, glipizide, all these. We don't want that because that, as we talked about, compounds the insulin resistance and makes everything worse. And avoid low sugars. So your sulfonylurea medications, your glipizide, your glyburide, glimepiride, your insulins all cause low blood sugars, which can be very risky if you're driving a car, if you're elderly and walking, you fall and break a hip. These can be major life-changing events, so we want to avoid them as much as possible. So because of that, we've seen the new medications coming out like the SGLT2 inhibitors, the Invokana and Jardiances and Farxigas of the world. We've seen the GLP-1 agonists, the Victoza, Bydureon, Trulicity, Ozempics of the world. And of course, those have a whole new weight loss indication, which has gone crazy. But these medications have been shown to either not hurt the heart or even be protective to the heart, don't cause a low sugar, and don't cause weight gain. So these tend to cause weight loss, and they're effective at controlling blood sugars. So we will touch bases on type 2 medications. There's a long list, metformin being the age-old number one that everybody gets. Most providers are going to tell you after diagnosis, lifestyle changes. And we talked about that. Then you're going to see metformin come in. When I did this, I just started them at the same time because people are tough to change lifestyles. Americans are very resistant to changing the way they do things. Metformin helps balance your sugars better. It doesn't cause a low blood sugar. It helps make you more sensitive to the insulin. It's a very effective drug. Can have some nasty side effects. Most people do okay with it. And there's another long list of oral medications before you get to the injectables. Bob Bush, Dr. Bush out of Albany endocrinology always told me in our lectures and discussions, all roads lead to insulin. Because we fail at the lifestyle changes, over time, the oral stuff just doesn't work and we end up on insulin. Type 2 patients do phenomenally on an insulin pump. Unfortunately, it's not addressing the issue of the insulin resistance, along with all the other stresses that we talked about associated with insulin resistance, which have more of a negative effect than just diabetes. We're hitting the stroke and cardiovascular issues. So that's the brief medication one. Like I said, I'll get back into that in the future. Monitoring, complications occur. You got to watch the eyes, at least an annual visit to make sure you're not developing bleeding spots or diabetic retinopathy, number one cause of blindness. Cardiovascular health, make sure you have an EKG on file somewhere. Make sure someone's doing a stress test once in a while, especially if there's a family history or you have other risk factors. Getting your feet checked, making sure there's no neuropathy, or if there is, we're watching for signs of infection. We're making sure our nails are trimmed so we don't cause further issues. General health panels to monitor kidney function, liver function, all that good stuff. These are all preventative maintenance things that need to be done with type 2 diabetes, and at some level should be done for everybody. So that's how you manage it. That's how you monitor things. It's not the end of the world. Like I said, we'll get into the medications more in the future, and certainly talk more about the carnivore and low carbohydrate diets, which I'm a huge fan of. This is the basics, the starting of the basics of diabetes. We'll build the foundation, because type 2 diabetes is extremely complicated. And like I said, I don't think all of the questions have been anywhere near answered. I think it's important to remember it's a multi-billion-dollar industry for pharmaceutical companies. So keep a critical eye on things, ask questions, talk to your providers. What are the side effects of this medication? What do I need to do? For example, when the SGLT2s came out, the Invokana, Jardiance, Farxiga group, this helps you pee out sugar. It makes you pee more often. It's sort of like a mild diuretic, like Lasix or furosemide. It makes you pee out more, lowers your blood sugar, doesn't cause low blood sugars. Because you're peeing out more sugar, you're losing some weight, you're peeing out calories, but you got to make sure you stay hydrated and you stay clean. Otherwise, your risk for urinary tract infections and other complications goes up. So ask about your medications that providers are putting you on. What do I need to do? Do I need to check my liver annually? Do I need to watch for a rash or watch for different complications? Stay hydrated, test more frequently. What ideas do you have? What do you suggest? So be fluid with your providers, ask a lot of questions. The internet is wonderful. There's lots of forums that can be very helpful, but keep the provider in the loop and get your information from people you trust. So that's the basics of type 2 diabetes. It is a silent killer. It's actually started now getting credit for on death certificates as opposed to a cause of all the other issues. And unfortunately, it does cause many, many other issues. But please, I hope this has been helpful for you. If you have questions, let me know. I would love to address them, and certainly can do 500 or 600 more videos about type 2 diabetes. We will certainly touch on this in the future because it is a very interesting and unfortunately extremely common problem. So throw some comments out there, throw some questions, your thoughts, your ideas. Give us a like. I'd love a subscribe, because we're going to try to bring all kinds of new things and different things and review things for your entertainment, for your education, for your guidelines. Again, share your stories. We do love to discuss them. And most importantly, stay healthy.